Okay, so I'm going to take 3 or 4 minutes to give an introduction to this particular topic. So I do not have any financial disclosure to relevant to this. These are my financial disclosures. And if you see a myopia at this point of time, in this graph, excuse me, in this graph, you can see from each of the continent, probably the severity is increasing. In some of the places in the world, myopia is at a lower prevalence. If you look into Southeast Asia, it's almost reaching to 90%. But one thing which is very clear in this particular slide is everywhere it's on an increasing trend. So there is a paper from Brian Holden. It says that the prediction could be as high as 50% of the children can be myopic by 2050. So that's the way the projected thing. That's why in each of the location, wherever you are, even within India, wherever you are, the trend is increasing. We haven't reached 90% or so yet, but it's on the increasing trend. So what are the typical factors we need to consider in myopia management? First is, can we prevent the development of myopia? That's the number one. And once you have the myopia, can I look at high-risk characteristics of these patients? And can I look at halting the progression of this so that most of these people, when they are 20 years or 30 years, they don't go into the pathological group. So that's the three stream of things we need to look at when you really manage myopia patients. So this is my last slides. I'm just going to give a very comprehensive management strategy for patients with myopia. So you have to do some basics checkup along with refraction. You need to look at the axial length. You need to look at the alignment. You need to look at the torchlight examination and a comprehensive evaluation of the eyeball. And I also put pedigree because family history and the screen time and for everything is important. And also sunlight exposure and the refraction, we need to do it. And the first and foremost thing, what everybody can do is a behavioral change in the child. What is those behavioral changes? Two things. One is reduce any kind of screen time. Second thing is increase the outdoor activities. This is a baseline for every myopia management what you put to a child. This is not an alternative. Many parents and many children will argue in the clinic, oh, I am using these glasses, I am using these drops. This is not replaceable. This is in addition to the behavioral modification. That's the right thing to do. Then we have glasses. Many people have a belief that undercorrection is the rule. Never. Give a full correction of myopia. Then you can give drops if there is no peripheral hyperopic component. If you have peripheral, if there is esophoria, you can give bifocal. If there are peripheral defocus is happening because there is more hypermetropia, that's the stimulus. You have to use this peripheral defocus lenses. And then orthokeratology can be used in little bit older children where a management of myopia as well as prevention of progression can happen. And sunlight, always respect the sun, which you used to do in the past. Respect the sun because get up, and even in the night time, what has changed in the last few years is sleeping time of the children and even parents has changed because we have electricity. So try to respect the sun, and you can use drops, you can use peripheral defocus lenses, or a combination of that if you still find the progression. So success rate of either you drops or you use defocus lenses, it's somewhere between 50 to 60%. There are still some unanswered questions, But this gives a comprehensive management. How do you want to take care of this? And you can take the QR code. It will directly lead to a document by World Society of Pediatric Ophthalmology where it tells you what are the options available at this point of time for myopia and what works and what doesn't work. Thank you very much.